familiar with New Beauty magazine? So New Beauty magazine is a magazine that focuses on aesthetics, and we were named the #1 asked for in-office procedure for 2 years in a row. And that is a huge, huge accomplishment for us, so we're really excited about that. To give you a little bit of history about Ultherapy, we're the only non-invasive skin lifting procedure that's cleared by the FDA. And we're cleared to lift skin on the neck, under the chin, and the brow, and our latest indication is reduction of fine lines and wrinkles on the décolleté. So we launched in Europe in 2009, and then when we were going for our FDA clearance in the United States, we found out that there wasn't any other technology of its kind. So for example, if I were to go to the FDA with a laser and say, my laser is doing what this laser is doing, and here are the clinical studies to prove that, it only takes about 7 months to get your clearance. When there's no other technology to point to, that process can take years. So that is what's happened with Ultherapy, is it took us years to get our FDA clearance because there's nothing else like it. So once we learned that, we filed 235 patents. We're good to go for several years of being the only device of its kind. So it's really exciting. You won't see anything else like it. I'm going to talk a little bit about the aging face before we really get into the science of Ultherapy. The reason I'm going to explain this is because it's important for you as a consumer to know how you're aging, so that when you're looking and reading about different technologies, you know what to ask for. So you may be here wanting something completely different than what Ultherapy has to offer. And so it's really important for you to be educated so that we don't do the wrong treatment on you. So what happens first in the early signs of aging is we have sun exposure that's causing aging. Your lifestyle causes aging. So whether or not you're getting enough sleep, or if you're drinking a lot of alcohol or the wrong type of diet, all of that plays a role on your aging. You also have genetics play a big role, and then we have people hate gravity, but I love gravity because it provides me with a really good job. So then we have our underlying changes. So we have decline in collagen production. So right around late 30s, early 40s, we're not producing any more collagen. It's on the decline. And as I explain the science of Ultherapy, we're stimulating collagen. So ladies, I don't know about you, but if I can put my aging in neutral, I'm going for it. So Ultherapy is my new favorite. And then we have loss of elasticity. So with loss of elasticity, think of a latex balloon. If you fill it up with air or helium, and it's nice and tight, and then all of a sudden when that starts to escape, the balloon gets a little bit crepey and wrinkly because it lost its elasticity. That's what's happening with us as we age. And then we have the visible changes, where we're getting the deep folds here, we're getting the jowling. What's happening is when we get these deep folds, our muscle is actually starting to slip, and that causes that. It causes the deep troughs, and then our fat underneath the skin is actually starting to slide down and settling along our jawline, and that's what causes the jowling. So the good news is we've got technologies and procedures that can help to reverse some of that and help slow down that process. So the science of Ultherapy, what is happening is we're delivering little thermal coagulation below the surface of the skin. So this would be pre-Ultherapy, during Ultherapy, and post-Ultherapy. So you can see these little white dots right here. That's where we're actually delivering the heat and the energy. So you're thinking, how is ultrasound doing that? What's happening is the ultrasound waves are going through the tissue and imaging, just like imaging a pregnant woman who's, they're looking at the baby. Same thing. But the difference is we have cartridges that looks like this. We actually call it a transducer. Those are programmed to tell those sound waves when to cross over each other at different levels of the skin. When they cross over each other, that creates friction that heats up to 70 degrees Celsius, and that's what's causing the change. So we can go all the way down here. We call this the connective tissue. So just a little lesson about the structure of the skin. Here's our muscle, connective tissue, fat, and then we have our deep dermis and then our upper epidermis right at the very surface. So we have the ability to treat 3 different levels. Okay? The significance of treating at this connective tissue layer is when a plastic surgeon's doing a facelift. Okay, we talked about how the muscles start to slip. They reposition those muscles, and they have to pull the skin back. They reposition the muscle and sew it back into place before you started aging. Then, while this connective tissue is exposed, they take a little cauterizing instrument and they cauterize the bleeding blood vessels. The reason for that is they want to minimize the bruising for the patient after the surgery. But what happened is while they were delivering those little thermocoagulation points, they could see that tissue pulling tight and contracting. So they add extra as standard practice now because that's another type of lifting. So this is why we call it a non-surgical facelift. You're not getting the surgical result because we're not repositioning the muscle, but we're doing the same thermocoagulation injuries that a plastic surgeon is doing during surgery. So you are going to get some lift. And it's scientifically proven that we're doing this every time we fire the button. Okay? Pretty cool, huh? Got your attention now, right? So this is exactly what's happening. So you can see where the little red dots are. That's exactly where we're delivering the energy. So we're bypassing the surrounding tissue. So there we are. The first pass is the connective tissue. Then we have the deep dermis. These first two passes here are standard in a standard treatment. Then we have the ability to go more superficial, and that's an added-on treatment for people who want to address fine lines, more crepey type skin. Also a great place to treat if you want to have that added collagen stimulation. So we can stimulate collagen in 2 different levels with almost no downtime. Okay? So here's the difference with Ultherapy and depths. So I'm going to explain different modalities of energy-based treatments that are available so that when you're reading magazines or you're deciding what's best for you, you understand how all of them are working. So we have our Ultherapy first, and again, where the little red dots are exactly where we're delivering energy. Then you have your surgical facelift. Kind of explained that, where they reposition the muscle. You've got some downtime with the scarring, and if that's the route you want to go, then you should definitely do it. But for those of you who don't, you have your Ultherapy option. Then you have lasers. So see where these little white columns are? Lasers are actually driving energy through the surface, and so they're taking out little columns of tissue. And that's also stimulating collagen. So for example, if you were to cut yourself, your body stimulates collagen to heal that wound. So that's what's happening with lasers and Ultherapy. Okay? Then you have radiofrequency. So the common names for that would be thermage, Pelave. They put a hot plate on the surface of the skin, and then they drive the heat through the surface. So the challenge with this is that is very dependent on what you can tolerate as a customer. So sometimes they have to turn it down. So we don't know exactly how hot we're heating the tissue, but most people will get some sort of tightening with that heat. Okay, so those are the differences in the modalities. Now, the significance of going this deep, I explained we're going to the same level as a plastic surgeon when they're cauterizing that connective tissue. Lasers can't go that deep for 2 reasons. The first reason is because they don't have enough power to maintain the heat to get to that level. The second reason is you've got facial nerves running through here. If a laser goes all the way through there, they're going to destroy your facial nerves and cause other types of problems. So for safety reasons, they can't go that deep. And then with radiofrequency, that can't go deep because we would literally burn the surface of the skin. So Ultherapy is the only non-invasive technology that can get to the same level as a surgical facelift. Now we're going to talk about the temperature. So this is a temperature chart of what happens to human tissue. The 40 to 50 degrees is your radiofrequency devices. In some cases, people can see some skin tightening. And for those who do, they love the results, and they actually get really good results with Ultherapy as well. Then you have denaturization of the human tissue actually occurs between 65 and 70 degrees Celsius. That is exactly where we're heating the tissue with Ultherapy. So an analogy for that would be if you're putting an egg in a frying pan and it turns white, that's exactly what we're doing deep in the deep layers of tissue to actually create change and corrective change. And then you have your lasers. So remember I showed in that graph right before where we're taking out the tissue. So we're actually destroying the tissue so that the surrounding tissue can heal and stimulate more collagen. Okay? So now we've had our lesson on all of the different modalities. So we also have a patent where we can actually see where we're treating. And the nice thing about that is we can customize the treatments for each individual that's on the table. So this is an example of what we're seeing. This is just a side-by-side color picture. So if we see bone, we can avoid the bone and we can customize the treatment to not hit bone. That just causes unnecessary discomfort. If we see blood vessels, we can try to avoid the blood vessels to minimize bruising, although bruising can occur in about 5% of our patients. So if you have a tendency to bruise, you may bruise with this. And then we can also see where our target is. So the ladies here have been trained how to read the ultrasound image and the structure of the skin, so they know right where they're at. And there's no other technology where we're treating. When we put lasers on, we put it on the skin and we fire away. So we know exactly what we're doing with this technology. This is the treatment area if we're treating the full face and neck. So it's just an example of the pattern that we follow. And we can customize as well. So if you want just a small area treated, we can do that. Or if you want to treat everything, we can do that as well. So you're wondering, am I a candidate? Who's a good candidate? The perfect candidate is mild to moderate signs of aging. So we can treat beyond that. It's just that they're going to customize the treatment a little bit more for you and do an appropriate treatment. Okay, so what we're looking at here is you can see right along the lower portion of the jaw, the tissue's been pulled up and she's got a more defined jawline. Okay, here you can see we've got a very young person versus somebody who is more advanced in their aging. So this younger gal had that hereditary double chin, and we were able to correct that for her. She was very insecure about it. And then you can also see her eyes are a little bit more open. And then the older lady, she actually had, she's lost a lot of weight. And for her, we can see sharpening of the jawline. And so I'm also going to state the obvious. She's also a really good surgical candidate. So there are people that will look at this photo and say, why did she waste her time? Why doesn't she have surgery? That person who's thinking along those lines might want to opt for surgery. Where the person who looks at that and says, oh my gosh, look at her jawline, what a great result for her, you'd be a good candidate. So it's really your own personal opinion as to whether or not, and what your personal expectations are as to whether or not you're an Ultherapy candidate. So if you're okay with a little bit of change, gradual change, we're using your own natural healing responses to create that change, then you're an excellent candidate. Okay? And so this lady did take 2 treatments to achieve this result following our standard guideline. So there's 2 ways to indicate a brow lift. Obviously the repositioning of the brow, but then if you look at the eyelid, how much of the eyelid is exposed. So in this very first patient, her lash line is somewhat covered, and then in her after picture, her lash line is exposed. So we were able to lift that tissue. So by lifting the brow, you also lift the tissue on the eyelid as well. Okay, the second person here, you can definitely see the arch there. This one down here, more of the eyelid is exposed. And then this one here, you can just see her whole eye is completely opened up. I love the chin results. So this lady here, you can see right underneath, the chin looks a lot better. Right here you can see, I mean, I think we dialed back the clock several years on this lady here. So just nice gradual change. And these changes occur over about 3 months. We've actually followed patients for a year where we took photos every month for 1 year, and every month there was progressive positive change. And so the results, do continue after the treatment. And then most people want to come back about a year after that, so about every 2 years, because they like to feel tighter. So women start craving that tight cheek. So we also have darker skin tones that it's safe to treat. People who have darker skin types have to be really, really careful of lasers. So this is colorblind, so it's safe to treat everyone. And then this gentleman here, you can see the sharper jawline. And what I like to point out about him is he didn't think anything happened. He didn't think that this worked at all until he saw his before and after photo. People just don't look at themselves from that angle. The other thing that's really hard to quantify, and it's hard to see unless you're really looking for it, but if you look at the tissue just on the cheek, you can see the cheekbone is tighter, And same with this lady here. So it kind of tightens the envelope. So if you're somebody who likes to get fillers, this is a great combination treatment with fillers because it tightens the skin and those fillers actually sit a little bit nicer. So I'm a fan of doing a little bit of everything. So my routine is I get my Ultherapy about 3 months before I'm due for my fillers. Then I start getting that tightening, and then my fillers is just kind of like icing on the cake. So here are the neck results. These are all one single treatment. So this first lady here, I mean, what a great result for her. So a lot of people, she weighed with a couple of pounds when her before and after photos, so she didn't lose weight. But if you look at this, a lot of people ask the question, did it dissolve the fat? Is that what happened? Remember I talked about strengthening that connective tissue? So that connective tissue just strengthened and pulled the volume up. So she still has the same amount of fat. It's just that her connective tissue is getting weak. Then this right here, you can see the tissue is much softer. These little bands here are called platysma. And so what happens as we age is those will start to drop. Ultherapy is not really doing a whole lot for the platysma, but a couple of units of Botox right in there will help to tighten that right back up and give a really nice look. But what Botox won't do is it won't soften the crepey tissue around the platysma like this did. Okay. Then we have this lady here. That's a really nice result. And so all of these are nice, subtle changes. A lot of people, they start getting compliments about their appearance, and they think, I'm not seeing much, but it's very gradual and very natural. What you can expect during a treatment is you come in, you'll have the consultation, we take photos, we make our little treatment guidelines on your face, and then apply gel and start with the treatment. So is anybody wondering what it feels like? Okay, feels like little hot needles poking you. Not bad, very manageable. It doesn't hurt when we push each individual button. What causes discomfort is, you can see these little treatment guidelines here, is when we're going over the same area multiple times, we get cumulative bulk heating, and as the tissue gets hot, we start to feel pain. And so the good news is the way the system's programmed is we can move around from area to area while the tissue cools, and it's very manageable. So if you're somebody who likes to relax a little bit, you can talk to Dr. Schrader about, and Dr. Fry about comfort management, or generally 800 milligrams of ibuprofen is what most people need. So very manageable. And then after the treatment, for me, it felt like I lifted weights with my face. So, because we're right at that muscular layer, and so it's just a little tender to the touch, but not bad. Like I said, some people experience some bruising, but for the most part, there's no downtime. And then for the décolletage, we have décolleté, décolletage, and chest. So depending on what brochures you're reading, or if you're from France or the United States, it all means the same thing. But this is our treatment pattern for the décolleté. So we treat from the breast tissue up to the collarbone. And we've got reduction of fine lines. And so amazing results with this procedure. Basically, that really is the end of the